thank you everybody for making time. I know it's on short supply. We hope that today's session will be both meaningful and impactful and give you the right education around how we can help automated, redundant, and volume-based repetitive work. My name is John Vasicek. I represent JIF on the commercial side, and I'm joined by Sanjeev Talwar, who looks after the technical side for us. In terms of housekeeping, we will go through the presentation deck, give us an opportunity to go through any Q&As that myself and Sanj will field. And then if there's sort of time at the end, maybe just show you a video around how MyBotGP actually works in practice. So without further ado, let me quickly share my screen. Hoping everybody can see the screen. Do forgive us, this is the first time we've moved from MS Teams to Zoom. So if things do go wrong, we will pivot as best as we can. So today is all about MyBotGP's range in respect to Docman filing. MyBotGP is a product range that automates certain flow processes. The organization's name is JIF. We're not a new kid on the block. We've been around for close to a decade working in the primary care sector. And as mentioned, we developed MyBotGP to support the digital transformation agenda, to automate certain workflow processes safely, and to ensure that we can save both cost and time. So we've got a number of products for EMIS and a number of products for System 1. For EMIS, we have our normal pathology filing, which is our anchor product. It's the one we went first to market with, and at this stage, and maybe under competition with Docman, one of our most premium products and adopted products. Very simple. You set the guardrails in respect to what you want MyBotGP to touch and to automate. You decide what good looks like in terms of, is a normal actually a normal? You could look at things like the lab ranges, which get sucked in directly from the lab report. You can decide if that is a low clinical risk, and you're happy to file that as normal each time. Set up the interface, and there you go. You can supersede the lab ranges based on your experience for whatever reason. You could compare different tests to understand if there's been any changes to tolerance levels that you set. You could look at keywords, which is a very powerful way of making sure that a normal is in fact a normal. It will look at the problem page. It will also look at the pathology test for different keywords that are either absent or present. And of course, you can then separate by gender and set different age ranges. The other tool is new, but very, very powerful. It's our EPS repeat prescriptions. So similar to PATH, we've provided you with the ability to go through certain guardrails. Think of it as a big filter. And every time you get a repeat prescription request, it will go through those 3 guardrails, and it would leave you with a very small balance of ones that you can approve electronically. Today, we'll speak about Docman filing. And the strap line here is simple. It's to liberate your teams. So the idea is to get back time, save cost, save money, redeploy that time into something more meaningful, less remedial, and ensure that we can minimize the amount of mistakes that happen when humans process large volumes. Today, tomorrow, the next day, the same thing over and over again. So we're going to show you how we can automate that process. You train the letter once, it will do exactly what you've told it to do, nothing more, nothing less, and you will never have to do that again. So one of the things that was critical to our success was a relationship that took months to sort of tie up. As you can imagine, contracts within the NHS is quite a lengthy process with all the protocols in place. But we are proud to say that we are a strategic partner with HBL ICT. And what does that mean? It simply means that our automation is hosted and lives in the cloud within an ICB data center. So that means we are safe, fit for purpose, locked in, and it means that we can deploy and implement the product typically without any hang-ups and so forth. Another claim to fame is we won a government-funded program, now called HIN, Health Innovation Network, previously referred to as Digital Health London. And it was a program that identified different health tech vendors through eligibility criteria that could drive digital transformation within the primary care sector. We are proud to say that I think it was just last week, we were notified that we've won another piece of that puzzle, and look forward to working with that automation and enhancing the digital adoption mandate within the NHS. So we've tried to keep things as simple as possible, and I personally believe that simplicity is the ultimate sophistication. So we had to think about the problem. What is it that we're looking to solve? What are the everyday struggles within primary care? And it really came down to a host of things, but it comes down to time and the lack thereof. So to build on that and articulate that, we actually thought that in most cases, we aren't really cognizant of our small things that ramp up, that are done every single day, that are remedial, actually steal and waste time and cost. So we had a bit of a think about it, and we came up with the coffee and tea analogy. Very simply put, there are 4 individuals in this picture. They could be GPs, they could be practice managers, coders, but 4 individuals that are drinking, say, 2 to 3 cups of coffee or tea, if that's your preference. They're taking around 15 minutes a day, which equates to 91 hours a year of wasted time for each individual in this photo. It's meant to be somewhat theatrical because nobody knows who's getting their coffee first, and I think they're all aware of how much time they're wasting. Now, that's 91 hours for everybody in this picture. So based on a 9-hour day, that's over 10 hours a year for every person in this picture, coming to around 42 days of lost time. And we know letter management takes a lot more than 15 minutes each day. You could build onto this, and if you're like me, I probably do about 6 cups of coffee a day, much to the dismay of my leaders. So I'm probably doing double that. You can add things like having to go to the loo, which is absolutely necessary, making a sandwich, loading the dishwasher. And before you know it, you've actually lost about 10 to 15% of your productivity within your working hours, your core working hours, which is an absolute sin. So we put together a business case to say, well, what can MyBotGP Docman Filing actually do, and what is it all about? So we've based this on an average list size of 8,500. And from what we could tell through speaking to customers, through research, through surveys, we've been able to establish that approximately 125 letters comes into that average size practice on a daily basis, coming to around 40,000 letters that have to be manually entered, validated, categorized, and then pushed through the workflow system just to get to the point where a clinical decision can be made. And it's done manually every single day. So whether you process that manually today, that same letter category will come in the next day, and you will do exactly the same thing over and over again. So the idea is that we are able to provide automation that takes care of that in a very safe way, which is self-configurable, done your way based on your practice and the way that you do things around there. So we can handle multiple letter types that require different actions by different people, by different departments, and we will essentially mimic the way you do things at practice level. Minimize the amount of human error that typically creeps in when doing volume-based repetitive work. We will ensure that each letter is dealt with quickly. And based on a few variables, you could ramp this up to thousands of hours that have been wasted and could be possibly saved by automating the process safely. Now, one of the things that is a differentiator in terms of automation versus human physical effort is that MyBotGP certainly won't drink 3 to 6 cups of coffee a day. It won't take annual leave. It works on bank holidays, weekends. So any backlog that you have because you've taken leave or because somebody suddenly resigns and there's not enough hands on deck, MyBotGP will continuously run 24/7, 365, and never take leave. So you have this continuous process flow of just automating one letter after the next, after the next, after the next, based on how you set it up and configured that particular workflow and letter category. So this is the sort of overview of the MyBotGP range. So our mission is quite simple. It's really to drive and to partner with the NHS in terms of digital transformation. It's no longer a question of if we should automate, it's a question of when. So will we be early adopters, conservative adopters, or will we wait to the precipice to make the decision and obviously suffer the consequences of waiting that long? We aim to reduce time, cost by deploying the most advanced automation programs in England today. So what is important to note is, and as previously mentioned on the second slide, is that we reside in an NHS ICP data center. That means that we are signed off for our DTACs, DPIAs, safety. We don't see any patient information, only what the bot has processed in terms of statistics. We've got it certified by a CSO, so we have a DCBO 129. And for those that don't know what that means, is a clinical safety officer is essentially a clinician that's studied further to get to the point where they're able to validate and issue a safety certificate in terms of how the tech interacts with the protocols and daily sort of operational workflows at practice level. Now, very important, we know that standardization is not something that is very rife within the NHS. And that basically means that every practice will do things in a different way. They'll do the same things in a different way. So there are certain nuances to the way that they wish to work, and they wish to sort of apply their workflow in terms of triaging to different departments, different people, creating tasks, setting reminders. So it is bespokeable and self-configurable at practice level, meaning that it's your rules and it's your way. We are experts at working with both EMIS and S1. We will take you through the pricing a little bit later, but what I can tell you now is that our pricing philosophy is simplicity. It is easy to understand. It is a fixed cost, meaning that we won't throttle you if you exceed certain thresholds in terms of the number of letters going through, the number of pages going through. So that means you can drive and push everything through the automation if you so choose. There are different models and mechanisms in terms of the pricing. What we're seeing is a lot more PCN acquisitions, federations, ICP pilots, and we'll cover off what that looks like in terms of the different derivatives in respect to the pricing piece. And then just to reiterate, we are an NHS ICT partner. We won the HIN program cohort 6 a number of years ago and have just won another prestigious award in terms of that. And if I had to give you a quick synopsis of how fast we are growing and why we are the fastest growing RPA business in England, when I started, we had under 100 practices that were using the automation. We are now in hundreds, working with PCNs, federations, and ICBs nationally. So we try to keep it simple in respect to how we conceptualize what automation is. So we would like you to think of it as hiring a remote Docman worker that will use Docman on your behalf, that is a Docman expert. So you would show MyBotGP what to do, configure it, get it set up, and you would do that once and then never again. So you would show it what you would want to do with it. The fact that it also files in the patient record is a big differentiator. You can file and triage letters straight away. Importantly, it will work with or without IntelliSense, and if you are using IntelliSense, it will supersede that, and it will continue checking Docman by itself to action all letters. So we've had a number of practices come to us with a very clear problem statement, meaning that they've got backlog because of a resignation, because they've broken off from a larger practice and started their own sort of site with their own ODS code. And what that's meant is they have backlogs of thousands of letters, which has massive sort of safety implications. Having to employ locums to catch up, having to give overtime over weekends, which just ends up burning your resources out even more. So, you're creating more problems than you're solving for. So MyBotGP will ensure that it churns through all of that backlog, gets you up to date, and keeps you up to date. So you can file with without letters being seen where appropriate. So, if you think about two sort of examples, you could think about an NDA, which doesn't necessarily need to be seen. So it flows straight through the patient record, and that's that. You can think of a 111 letter that needs to go through the same bit, not much to do or action, don't have to see it. However, with the guardrails and the logic in terms of rules that you're able to use to train and configure, you are able to add in different keyword strokes and logic. So, for instance, on a 111 letter, you may use, and it's completely up to you, this isn't a suggestion, we don't do any of that, but if you were so inclined, you could add the keywords self-harm or attempted suicide, and MyBotGP will pick up that free text and triage in a different way so that can be actioned by a clinician or whoever is responsible for taking the next steps. You would be able to send it to teams or folders, to people. You could push it through the Docman templates, and we'll touch on what that looks like shortly. You can send it to different teams like pharmacy, people and places. And as we build up momentum, we're working with many different types of practices, so an array of list sizes, an array of letter categories, and we have a few practices that are using the automation to run through hundreds upon hundreds of different letter categories. In fact, we have one site that's pushing 500. So lots of value driven at different specifics, different dynamics that would impact the number of letter categories, from the demographics to the list size to the complexity. So we are able to deal with all of that, unlimited and without throttle. So one of the big things that we had to realize in the way we used to work and show up was that a lot of what was being available through third-party robotics was the inability to pivot at pace. So if you wanted to change a rule, update anything, if the login page on the clinical system changed from top left to top right, in the past, it would basically render the automation redundant because it wouldn't be able to pick up where it needs to log in and what the anchor points are. With MyBotGP, all of that can be changed. We manage that in the background. If there are any changes, we simply update that in the cloud, push that through, and MyBotGP will restart, and it would all then run as it's intended to do. So how does it work? So it comes to the manual piece of firstly getting the letters onto getting the letters onto the system, onto Docman. So what it would do is it would collect the letter. So this could be something that you scan and send through from NHS Post. It will also put in NHS Mail, and then basically complete the Docman template based on what you tell it to do and where you show the different anchor points and so forth. So it'll validate the NHS number, the document type, be that diabetes, ENT, cardiology. It'll categorize the letter by applying the relevant information from the particular document that you've trained. So that could be something like the event date, the department, the hospital that it's come from, even looking at the categorization of that letter. I will pause there and just say there is a caveat that we will do everything up to the point of clinical coding. As mentioned, no RPA or AI is ready to take the actual risk of making a clinical decision. And we do believe that it'll be some time before we even reach that point. So we will allow the individuals with the necessary skills to take those clinical decisions and action them accordingly. So importantly, I'll mention again that it will file the letter to the patient record. And that just means that GPs, when seeing patients, can be confident that everything is up to date in respect to any letters that need to be accessed or filed in that session. MyBotGP will recognize every single letter type and basically action it on your behalf. So what next? So we get everything onto the system. We've validated, categorized, decided on templates. To the right, you'll see the document template, which I'm sure you're all familiar with. You can then, once you train the letter, push it through a template and use the Docman functionality that already exists. So this isn't a new product. This isn't something that's replacing Docman. It literally uses Docman as a super user and allows you to use all the facts, features, and benefits that's available within the Docman system. So that means that you could do configuration, anything from pushing it to certain folders or templates, triaging to different departments like pharmacy or specifically coders, people, roles. You can add custom rules. You are able to create different tasks, assign those tasks to the appropriate individuals, departments, etc. You can send reminders and set notifications, and even do escalations and get someone in trouble if you so choose. So that is a quick overview of how it works, what our value proposition is, what the pain points are that we're looking to solve for. We're now at the point where we come up and say, well, how do we know what is being done on a daily basis? Because that's important. So nothing is lost. Everything is recorded on the patient record. You would have 2 applications downloaded on the machines of your choice, be that a desktop or laptop, and you would have 2 super users that do the configuration. That then goes to the cloud. Cloud does the automation and pushes it back. You then get an audit log on those 2 applications where you can look at the transactions in 3 different tiers. So the first would be looking at it by filings by date. So to give you the date, how much has been filed, and a host of different other metrics. You could look at it by the document type. So what type of documents has it filed? And then last but not least, you get a granular view of everything that's maybe sitting there that hasn't been trained or hasn't been, or that's been seen and sucked up in the memory but hasn't been filed. So it's basically saying, I've seen this, I've got it in my memory. You haven't enabled me or trained me what to do with it. Please show me what to do only once, and I'll do that each and every time, nothing more, nothing less. There will be a distribution email that goes out around 5 p.m. every day. So if you had a large team of coders, a large team of people, sometimes people double hat, sometimes people are 100% focused on working with Docman, you can have as many people on that distribution list as you so choose. So everyone will get a snapshot of what MyBotGP has done for that particular day. So we get on to the most contentious piece, which is pricing. And as mentioned, our philosophy is simple. We want to be accessible. We want to be affordable. We want to ensure that each practice has the ability to access the automation as we drive the digital transformation story. We want to make sure that everybody has the ability to onboard the program, to drive that digital adoption, to make sure that we are future fit and fit for purpose. So we have a fixed cost structure. Very importantly, that means that there are unlimited letter types and volumes that can go through. So you can push through everything. You don't need to make decisions on specifically what categories you may use or have variable pay to sort of budget for and cost to budget for throughout the year based on any spikes and exceeding thresholds. So if we think about this as buying one sort of product by a practice, the pricing is quite simple. It's a setup cost of $749. It is your list size at 30 pence, and that is essentially your annual subscription fee that you would pay once off. Along with that, there is the hosted service based fee that is calculated on list size. So this is essentially when we deploy, we would have to order the virtual machine, have that span up in the cloud, and this is to cover the cost of that hosted managed service. We've been able to create 3 different tiers. So the first patient to the first 10,000, you'll pay 7 pence per patient. The next bank of 5,000, you would pay 6 pence. And then anything upward of 15,000 heads, you would pay a flat rate of 5 pence. MyBotGP Docman Filing comes configured with a 2-day configuration session. It is supported and configured, but self-managed, and we have a fee of 1250 for that process. Now, if you were looking at an additional sort of product that you would like to add, and often this is what we are finding with our practices and PCNs, is that they do take up more than one process, and it's quite simple. If you're thinking about Docman, you really are saving operational administration time. But if you think of something about PATH or EPS, you're saving clinician time. So you actually bring those two together and create quite a powerful automation story for that practice. So if that is something that you would want to look at, you would then have your reduction in the setup costs, the same thinking around list size at 30 pence. Your hosted service will drop to 5 pence per patient. And then, of course, based on taking Docman and another product, you would still have the 1250 as a configuration setup fee. Now, we have, as mentioned, had a strong uptake in terms of purchases at PCN levels, ICB levels, federation levels, having won various pilot programs and so forth. And there's a customized pricing metrics that we use for that, with an additional discount of around 10% approximately. So if we do a matchbox calculation based on an average list size of 8.5, you will see the breakdown of that cost line: 749 for the setup cost, 2550 being the list size at 30 pence, and 1250 for the configuration setup, bringing it to 454. And then the hosted fees coming in at around another 6, so just over 5.2 or around 5.2 for an annual license for one product. So I hope that that has been informative, that there's been enough clarity to make sure that we are able to answer any sort of questions. We're now going to pause and open the floor to go through the Q&A and answer as we move along. So let me quickly stop sharing and go through the Q&A. Okay. So a few comments about the mic, about jumping off. A question around if there was any sound for anybody. Mic is not working. There's a question around, does it clinically code information such as diagnosis and blood pressures into EMIS? Unfortunately not. We don't do the clinical coding piece, but we do everything up to that point, which is where the time saving actually sits. We'll leave the clinical coding piece to a human brain. The next question is, so does the code clinical diagnosis? So does this code clinical diagnosis? Unfortunately, similar to the previous question, we leave that to a human being that's will apply their own skill and make those decisions. Just going to pause there to see if maybe there are any additional questions.
I can pick the next one up, John.
Sure.
So again, next question is, does MyBotGP pick up duplicates? Again, it would process duplicates. It would just process them the same way. Yes, it does. It will just put them against the actual patient because it doesn't know or is able to, you know, from a compliance point of view, it has to record every letter that comes through and cannot take out a duplicated letter. So it must actually file everything that comes through the door of Docman.
Then will there be another webinar meeting? Yes, we do. We have one every single month, and that is covering both pathology as well as Docman filing, and soon our EPS repeat prescriptions as well. Chelsea has asked, do you pick up medication changes on letters?
So
Sanj,
yeah,
I'll
good
leave that to
question.
you.
Yeah, good question. So I think the way the product is positioned is one will use keywords to work out where that letter goes. So it will not pick up in terms of changes in medication. The tooling is all around getting it out of, or rather filing it within not in folder, and perhaps putting it to a coding team to then look at that letter and then work out exactly how to triage that letter, or putting that letter direct to a GP, or again, triaging that letter how you see fit based on the letter type. It's not again picking up things in terms of coding or changes in medication.
Okay. Super. Victoria's asked, if it doesn't code, what happens to the document after the bot has filed?
So again, in Docman, there's a two-step process. You can, once you've filed it, it's obviously filed, and it depends. It's really based on how one wants to process your document. So there are certain documents which are filed and don't need to be coded. So there will be that tranche of documents which will go straight through. Then there will be certain documents which will need to be coded. And in that situation, all you need to do is simply create a task for either the coding team or the GPs who are going to pick up these documents, and MyBotGP will file it against that task. And just to add, MyBotGP is no different to a person filing a letter. MyBotGP will have the same username and password as a user would. It replicates what a user does. It will log into Docman, it will navigate to not in folder, it will pick up the first document, and it would literally go through each line by line based on the rules that have been set. And then it comes to the end and it clicks the file button. It's exactly how a user does it, but as I say, with automation, it's working continuously day in, day out.
Great. Then we have a question from Leora. Hello, are you taking any more pilot practices on? Is there a trial period for 3 months before committing? Sorry if I didn't hear. So we're working through various channels to get to the point where we get to ICBs. As I said, we did win a pilot program with SWL recently. So these are all in the works. The idea is that we get to a point where there's economies of scale and that practices can benefit from those different funding pots throughout the hierarchy within the NHS. In terms of trial periods, we value our product. It's a minimum of 12 months. And we are pretty confident that once you get this running, you would never want to go back to doing manual again. So we have a very ambitious goal of never losing any practice. And we know that if you apply your mind and through working with us together, we will be working together for a very long time.
There was just another question prior to that, John. So will it recognize if pages are missing or are any errors? Again, it doesn't read or go through the actual contents of the letters. What it's doing is it's getting it out of not in folder and filing it against the patient. So that's its key here. So it's really important to understand what the tooling is all about. The tooling is taking the administrative piece, getting it out of not in folder, getting it against the patient, putting it against a coding team or against a usual GP. So again, it's really up to you how you want. It's getting it literally against that patient record. And then what we're seeing is practices are then picking up that letter from, because it's been posted to a coding team, they are then checking and working out how to then triage that letter accordingly. Okay.
Great.
Next one, if there are 2 dates in letter, really good question. So again, you've got multiple options in terms of the event date, which I think is what Nisha you're alluding to. So again, you would literally tell the system, I would want to pick up appointment date or clinic date. I think there's around 4 or 5 different ways one can decide. And this comes back to, as John said, everyone does the same thing completely different. So there are different ways one can set the rules around event date. You could say, you know what, I want to always pick up an appointment date. It would then get trained to pick up that letter type based on appointment date. Or you could say, I want it to pick up clinic date, etc. I want it to pick up discharge date. So again, you would train, or rather when the configuration specialists are training those letters, you would simply tell them the rules around that letter type, and it would pick it up accordingly. There's lots of flexibility around event date. You've also got things like where a letter comes in from a hospital and it doesn't have an appointment date or a clinic date, or it's completely random, or it's not even on there. You can do things like setting up backups, so it defaults to current date, so at least an event date is assigned to that document. So there's lots of functionality around that.
Perfect. Heather's asked, is it a case of we scan on and that's it, then it goes to coding?
Recognize that we've done.
We did.
I think there's one before that, John. So can it tell if a duplication has been uploaded? Again, it will just file from a compliance perspective. It's a remote worker. It cannot decide whether to remove a letter because what we're seeing is, and what we've told by our compliance officer, that it may well look like a duplication, but a further batch of letters has been sent because the prior one had page 14 missing. So it's not going to know, or there could be different content within that letter, and that's why that letter has been sent through again. So from a compliance perspective, it has to file everything that comes through and not make a decision to delete or decide if it's a duplicate or not. Okay. Is it a case of, shall I take this one, John? Is it a case of we scan? Yeah. Is it a case of we scan on and that's it, and then it goes to coding? I think what you mean. So bringing it back, what MyBotGP does, it logs on to the not in folder. So if you, as long as you have, and what do I mean by that? So anything that's coming into your not in folder, that's like the massive funnel. So as we know, within not in folder, you can have scanned copies, you can have NHS mail, you can have letter types coming in directly from hospitals. So whatever is coming into not in folder, you would, the configuration specialist would train it. Obviously those letters we classified into specific document types, like you would have a document type for oncology or gynecology or 111 or discharge, and there are specific types of letters, and then you would just provide the rules around those letters, and then it would simply just file automatically.
Okay, I think we've answered the question on delete duplicates, though it won't, it would file that. Just a thank you from Emma. Forgive me, Sanj, if I miss anything, just let me know.
That's all right. That's all right. You can take the VAT.
Liz has asked, is VAT added to the pricing? Yes, it is. VAT is it is excluding VAT, so VAT is on top of the pricing that we provided. Yes. Does it identify flag potential duplicates? I think we've covered that one off. It will file regardless. I think Emmanuel, Emmanuel, I think you can pick up that. Some letters include instructions to repeat a test at a specific time or task. Is MyBotGP able to detect this and generate a task for the clinician? Can MyBotGP also automatically set up a diary entry for follow-up with the respect of hospital instructions?
Should I pick? I think there was one before that. I think it keeps jumping, doesn't it? The list. So it's let's just have a look. Sorry, I'm going to try and merge to. Sorry, I'm just. Oh. There we go. Sorry, I'm just going to try and get down to that question. Just bear with. So how does it deal with paper letters that have to be scanned into document? Again, sorry, I'll just pick this question up, John, just before the other one. So again, as long as they come into not in folder and they're scanned and they are legible, MyBotGP can deal with it. It's all about, is that piece of paper, is that letter legible? Is it in not in folder? If it's in not in folder and the rules have been provided on how to file it, it will file it automatically along with any other type of letter within not in folder. Okay, some letters include instructions to repeat a test at a specified time, as well to detect this and generate tasks. So again, comment also to set up. Right. So again, it's all about working out how to get these letters to the coding team or to a specific GP, and the way you do that is through keywords. So in terms of instructions to repeat a test, that would then be picked up by the coding team to then decide. Again, coming back to what is MyBotGP all about? It's all about getting that letter out of not in folder, giving it specific rules to get it to against the coding team, who would then pick up and then work out what the next level of triage is. It's not about interpreting letters, working out medication changes. What about, does this patient require repeat time? It's not to do that. It's all about the administrative piece, getting that letter validated against the NHS number, making sure that it's got a classification in terms of what the type of letter is, making sure it's going to the right folder, the right department, the right create task, making sure that all of that information that you put when you file the letter prior to clinical coding is done accurately with standardized rules. Everything thereafter is done manually by a person. Okay.
Sanj, I'm going to let you pick up on the questions so that we are.
What format is used? I'm not sure I understand that. I think, as I say, it will pick up any letter coming into not in folder. So it doesn't matter what type of format that letter is, as long as it's in the not in folder. MyBotGP can be trained on it. It can be classified into a relevant document type, and then one simply just provides the rules around how you want to file that letter. And then essentially what you will see, your not in folder being processed and lower quantities of letters within your not in folder on a daily basis, because they're filed and tasks are being created automatically or are being processed straight through.
There was a question by Victoria. I'm not sure if that was before or after Emma. How does it deal with that one? Have you done that one? Okay.
Yeah. I think there's one about from Stephen, 5K. Do you want to take that one?
Yes. So 5K for the first year. Will the setup costs be reduced for the subsequent years? You would have a 2-year contract, and essentially in the second year you would be billed the same amount as you were in the first year. Most of our customers opt for a 2-year contract because there's a price freeze in year 2, and it just means that from a budgetary point of view, it's a little easier to manage.
And just to add, it's probably better classified as product updates as opposed to setup. It's all sort of mixed into that. So what happens is we're striving always to improve our products. There is regular enhancements, increased functionality around our products, and that's all part of that setup and product update cost, which is also part of that costing. Just to give you a heads up, it's not just physical setup. It includes getting updates and super cool functionality on a regular basis. Would it be possible to alert? Would it be possible to alert any action required? Really good question. So again, this comes back down to those keywords. The way that the tooling works is you would simply cherry pick or identify those types of alert keywords. And then the system would then look for these particular keywords like 2-week waits, police, suicide, things like that, which are kind of, super sensitive. And then based on those keywords, you can then start to actually file these letters either to a specific department or team or create a task. So we understand that obviously not all letters, are going to go the same way. But yeah, you can do it through the keywords in terms of triaging specific letters using specific keywords. I can take the next one. What's the accuracy like on dates? Again, the accuracy is as good as the letters that are coming into the system. So and when letters, so we have got functionality. I think there's around 4 or 5 options that one can decide, and also around event dates. So coming back to it, you can set dates to be clinical dates, appointment dates, current dates. There's lots of ways of how, and you can select dates. And again, these come back to the rules that you would give to the configurer, who would then set this all up for you. You would state, for that letter, I want this type of date. You've also got a really brilliant function that we just added in, I think last month, where you've got this backup option where 9 times or 99 times out of 100, one letter out of 100 may not have a letter, may not have the date that the hospital was sent. So in that situation, it would then set it to default date, to a current date, or again, you could have a backup date in terms of ensuring that letter is posted and filed in the system. Nothing worse than a letter to file just because it couldn't pick up the date. So there's lots of flexibility around date, and it's super accurate. Okay. Next one.
Question from an anonymous attendee. Have you got any videos, slides showing the actual process the bot does? We do. I'm just wondering if there's going to be enough time to work through that. Let's see how far we get with the rest of the questions, and if possible, we can walk you through how it would run through.
Yeah, and just to add on that, it's literally going to see a person opening up Docman, navigating to the not in folder, picking up the first document, and essentially putting in all the information that a person would. It's no different. Automation is exactly the same. It works like a user. It needs access like a user. It needs a computer like a user. It will log in. It will again click to not in folder, and one by one will work its way through the list. And if you think the rules that you've provided, you've classified the types of letters through document title, you've told it where to go in terms of where to pick up, what type of date to pick up, what folder to go to, what department to go to, what create review. All of these rules are literally just supplied into the platform or to the actual person that's going to be setting it up for you. And then literally you then let it do its thing, and it will file based on your standardized rules.
And then we have Shalem saying, would you be able to give a demo at our surgery? Certainly. If you can just pop your surgery name and your email ID together, we can certainly set that up post-session.
Okay, so I can take the next one. When the document is filed, will it go into a task inbox as they currently do? If so, do we need to do anything with the document? So, yeah, really good question, Aaron. 100%. It's exactly, think of it as a user. It's no different to a user. So if I'm filing a document within Docman, I set a create review. I want to create a task. You give it the task against that type of document, and it will simply do as what a user would. It would create a task for that team or to the person, the GP, the clinician, and they would then pick up that task and process it thereon afterwards. And that's it, really. There's nothing, just to answer the second part of the question, there is nothing you would do then after that, because essentially once you've clicked the file button, the file or save button, I can't remember what it is, I think it's the file button, it disappears from the inbox. And that's the key here. We are removing all of the documents on a day-to-day basis from that inbox. You want to come into work whereby in the background the super worker is working and it's literally filing each document, and you've already set the rules. So your not in folder inbox is not going to be hundreds and hundreds of letters from patients. It's going to be a lot less, if not zero, because all of the rules have been supplied, and it will then just create these it will file these letters, and it will put it to either the coding team or to a regular GP based on your rules, or it will just process straight through. That's the USP of our tooling. What happens if, so again, next question, if that happens to a bot, GP is unsure. What happens if MyBotGP is unsure, so it won't file? Again, simple as that, Andrea. If there is any discrepancy, if the patient is inactive, if the patient is deceased, if the NHS number cannot be validated, MyBotGP will actually it will skip that patient, because obviously it cannot proceed, and it will move that to an exceptions folder, which would be picked up by the team manually. So it's very clever in how it deals with that, because it obviously knows there is a end of day task, but from a filing point of view, it will skip that and pop it into an exceptions folder. How is it different? So again, I can pick this one up. How is it different from IntelliSense? So again, IntelliSense, I would say IntelliSense isn't in terms of very accurate. In how it, that's the sort of feedback that we get, and that's why we've seen a lot of uptake in our tooling. The key difference around IntelliSense is it doesn't file. It just simply proposes values that it thinks it sees, or rather that it sees on those documents, but it doesn't actually file. It still needs a person to then self-validate each bit of information, and it doesn't do things like popping it into specific folders and create reviews and stuff like that. So again, the key differentiator is our tooling physically files, removes it from the inbox, provides you a complete audit of what it's done.
Right. Can you go through the costings again? Sure. Just looking at the next one, in terms of costings, are the setup cost charged on an annual basis or just on the initial setup fee? It will be on an annual basis, recurring, depending on the term. So if we go through the rest, anonymous, we can try and see if we can just share and go through the costings again, or you can just drop us a message in the chat and we will be able to come back to you with a firm quotation based on your list size.
Okay, shall I pick up the next one? And does it have optical character recognition? Can the human coder easily cut, paste selected extracts into EMIS? So again, there's lots of different cutting edge technology that we use within MyBotGP. It uses a bit of everything, you know, automation, you know, algorithms, character recognition, etc., etc. What we do, as I say, its key basis is to get that letter out of the inbox, file it, give it to the coder, who can then, as you say, pick it up from their task inbox and then triage it accordingly. You won't be actually working within MyBotGP in that respect. You would still work within, again, it's probably a really important note to say, it will be no different to how you work today. It's just things will have been done for you. You would still then, what will happen is, a typical day is you will then go into your task inbox and you would see all the letters, if you're part of the coding team, have already been filed, and then you would then triage, as opposed to going into your inbox and then working out, okay, this letter needs to go here, needs to go there. You've already preempted those standardization rules through the rules. You've supplied them. The configurer, as part of the setup, has basically done that all for you, and then it's a case of you are then sort of 5 steps ahead of the game in terms of triaging those letters. Does the system still allow practice use to fill in? Yeah. So again, really good question. Does the system allow practice? So it won't. There's no different to how you work today. If it's a case of these types of letters, you would then they'd follow the same process, because you would essentially put them into a coding team, or to a coder, or to a team who would then triage these letters accordingly. You could also separate out these types of letters through the use of keywords. So again, you know, if you know what those types of urgent words are, you could actually put it to a different team. But again, the general rule of thumb that what we see is everything gets put into the coding team. They then will triage accordingly. I can take the next one. So do letters get filed? So again, it's exactly how you file today. So there's no difference. So MyBotGP is a person that is replicating a person. So when it goes into file a document within Docman, it will update all of the information, and it will click file. Those letters are then sent into, so once, as you know, once you click file within Docman, it gets updated into EMIS against the actual patient. So I think that's how it all works. It's no different to how a user would use Docman. Again, I think that's the same letter, Emma. What format will the letter saved as within the record? It's identical. There is no different. MyBotGP will use a username and password just like a user. It will log in, and it will effectively file that document in the same way that a user will, but with predefined standardized rules by document type. It clicks the file button right at the end, and then again, as we know, the standard Docman to EMIS process will kick in, whereby that will then get sent to the patient record. Okay, can you
create folders as per the need, or create rules? Yep.
Yeah, 100%. Really good question. Yes, you can. You will tell MyBotGP where to file the letter into which folder. So by document type, you will say, for these documents, I want you to go folder X, folder Y, folder Z. So again, you would simply give it, and that's part of the rules. You would tell how you and where you want these documents to be filed to, what folders, what departments, what create reviews, yeah, so all of that information within Docman. Will you provide built-in rules? Yes, so again, I think as John mentioned, the tooling now comes with an out-of-the-box 2-day configuration. Obviously, there's a cost element to that, but that we're working with some super cool partners who are experts in primary care, who will effectively work with yourselves. They will work out in terms of your document types, work out those triage rules, which again it's not too complicated. You then have all of those rules, you have all the document types. Invariably, what we see, there's probably, I don't know, a couple of hundred different types of documents that would go through an average practice, maybe more, maybe less. And then it's just a base case of standardizing those rules. Doesn't take too long, and then they would action and basically enforce those rules. So MyBotGP is updated to follow all of those rules.
How much of the configuration can be done in-house? So as mentioned, after the configuration service is kicked in, there'll be probably a balance and some maintenance piece, and we'll train you through webinars, through various other metrics and methods, and you'll get the idea just to pick up on maintenance and train anything that MyBotGP hasn't been able to see and be trained through the configuration session.
It's really good. Yeah, really good question. I think 100%. So post that kind of initial fast track of getting your documents configured, we then run regular webinars, unlike any software provider, weekly webinars, where we promote the fact that you can change everything, you can add new documents, there's no caps on cost. It really is a tool that you can add as much, many more letters. It's all about those rules that you set in the platform. Super easy. We've got a really good YouTube channel with 20 or 30 different videos showing you how to actually add. Once you've done it a couple of times, it probably takes 2 or 3 minutes to add a letter, to kind of train a letter. So post that kind of initial setup, super easy to add new documents as well. Okay, I think there was a question before that as well. Is the clinical coding done on S1 once the letter has? So this is predominantly for Docman, i.e. EMIS. We do have a product coming out for the equivalent on System 1 called attaching documents. So I would just say, John can give you feedback on that, but that's due to be launched, I would say, in the next 6 to 8 weeks. Same concept, looking at S1, looking at your batches, triaging those letters to a team, essentially the same sort of core functionality around that for attaching document System 1. But this is just purely for practices who use Docman on a day-to-day basis.
I'll just add to that, Sanj. Anybody that is using S1 at the moment and is interested in attaching docs, please do just drop your practice name and your email ID, and we'll put you to the list. And as soon as it is ready, we will then go live and roll out and get in touch.
There's one more question. Does this? Oh, yeah, Laura, that's correct. This is a MyBotGP, so it is a Docman automation tool, so it works hand in hand. So yes, you need to have Docman, and we would then be supplied once you sort of purchase the product. The prerequisite is we simply just need a Docman user ID and password. Just think of it as you've just secured a remote worker into your Docman, so no different. Develop coding. Do you want to take that one from Liam?
Yeah, sure. So I don't think we are in a position to be anywhere near making a clinical decision as yet. So at the moment, it is focused on the administration piece and taking that burden off. So everything up to the point where we have to use a human brain to make a clinical decision. So at this stage, nope. Maybe in the future, quite a number of years from now, until we are ready to have RPA or even AI make a clinical decision on our behalf.
Yeah, it's a path that we've chosen to not go down, because it's years away to be trusting tooling to actually making coding diagnostic type decisions. Again, here the key here is the administrative piece.
Okay, I'll pick up Chelsea. Do you have to use all 3 products, EPS, pathology, or can we just use Docman? Completely up to you. You could use one product, you could purchase all 3 and then roll them out at different times. But you can buy them in modular, one product or one automation process at a time.
I can take that one. I don't have much experience with this. If a practice scans the document, will it go? Is there any additional work other than scanning in for stuff? No, there isn't. So again, once you've got that document into the not in folder and you've supplied the rules, and I sort of keep harping, it's all about the rules. You literally list out the types of documents and you supply the rules around that, what folder to go to, what department, etc., etc. It will then process that document from the not in folder. Okay. So can we create rules for the document to be? Yes, you can. So Sharon, I can pick that one up. Sorry, can we create rules for the document to be workflow? Yes, you can. It can be workflow to a team or to an individual, essentially. Same functionality that you have within Docman today, it works hand in hand.
Okay, just another question around duplicates. I think we have covered that off.
There's no and right, again, coming back from a compliance perspective, the tooling is not able to make that call and shouldn't be making that call, because what's classed as a duplicate, as I say, it could be a 40-page document from a hospital, and the first letter came in with 38 pages and the second one came in with 39 pages, or there could have been an additional section added within one of the letters. We just don't know. And from that perspective, our CSO has been very clear that the tooling, especially tech tooling, should always err on the side of safety. And that what that means is it will process every document that comes in and left to the people, the team, to make those decisions. Okay, I can take the next one. What happens to letter it can't read? Again, if it can't read or process that letter, so the first thing that MyBotGP does, it looks at a letter and it works out, it tries to classify that letter, and it classifies that letter based on a keyword. Okay, so example, really simple example, look for the word oncology, and when you see oncology, that's an oncology letter. Look for the word gynecology, when you see gynecology, that's a gynecology letter, etc. I'm giving very basic rules here, but if it's unable to classify the letter, it will say I'm sorry, and it will then pop that letter to an exceptions folder and skip it. And then what the end of day, or not the end of day task, but what the team will do, will pick up those residual letters and process them manually.
Nina has asked, are all the letters scanned and done exactly the same way a person would do it? Absolutely. It just mimics the same process of a human being. So you tell it what to do, show it what the workflow process is, set all your rules, tasks, and so forth, and it would basically automate that on your behalf.
The hospital that uses 999 as the NHS number, this is also a dummy page. No, not too much. So again, it will, as long as it's classed as an inactive patient, it will then skip that letter, skip that patient. If it doesn't know, it's a dummy patient. If that patient is 99999, for example, is set up as a real life patient, then it won't know. It will just class it as a regular patient. So the key indicators here are it uses the system to advise of how to treat that letter. So as we know in Docman, you've got the EMIS blue bar. If in that bar it's saying inactive or deceased patient, it will then treat that letter accordingly and skip that letter. And that's how it works it out. How long does it train? Okay, so again, really good question, Stephen. How long does it take to train the bot initially? So there's initial, I think it's a couple of days, is it, John? That the configuration
2 days.
Sort of 2 days bolt on, where the partner will come on and effectively work with you to train your document types and letters. So you'll get to sort of 60, 70, 80% of your letters that are coming through your doors. And then post that, what we say is, because you need to have some kind of super user, some kind of person to manage it internally, we then run regular webinars and have an absolute mountain of training material on YouTube, which we then supply to you. You've got full access to. And I would say, just in terms of training a letter, once you're up to speed, it will take you no more than a couple of minutes per letter.
Is then followed up with, how long does the bot take to file a letter to the patient's record? Time?
Same as a person. So again, it automates it in the virtual machine in the hosting center, and it will go through each, it'll open up the letter and it will apply each bit of information that's supplied as part of its rules. And it might be a touch quicker, but automation is about accuracy. It's about robustness, and speed is almost not one of those kind of key indicators. It's really about accurately filing all of your letters to the correct patients, and that's the key here. Time, I would say, probably maybe a touch quicker than a person. Nisha, can new rules be added on? Very much so. So we appreciate things can change. So just to position what MyBotGP is no different to Accurix, System 1, EMIS, self-configurable platforms. So these are platforms which are shells, which essentially you log in and are configured to do what you want them to do. So in answer to that, any document type, any rule that you've supplied can be changed very, very quickly within the platform. You might want to triage it differently. You might want, different things have popped up and you want to treat that letter completely differently. Then you simply just put it to that relevant new folder, new person, new letter.
Okay, I'll pick up on your question. If you join as a PCN, does that set this up at all practice sites? Can each practice site have different, completely different rules? Yes, so boarded a PCN, each site under that PCN will have its own copy of MyBotGP, and you can configure it based on your own workflow and ways of doing things. Next two is just the practice details for attaching docs. Does it work with other clinical systems, e.g. Medicus? No, unfortunately not. We only work with EMIS and System 1. Email address provided. Can you please add Yolding surgery to the demo list, please? Certainly, we can do that. Thank you, Ribodominus System 1. Link to the previous answer. That's fine. Also interested if there's a solution for EMIS Web, EMIS X direct document workflow.
Yeah, not as of yet. It's in our kind of roadmap, but yeah, not something that's on the agenda for the short term. I would say purely about clients with Docman and/or with System 1, yeah, not at the moment.
And Sharon has asked, does it run 24/7 as electronic documents drop into the Docman all the time?
So I can pick that one up. So the way it works is you normally get sort of a morning run, a lunchtime run, and a supper run. It typically runs 3 times a day, which is more than ample for the documents coming in, because once it's in there, it's filing everything that it sees. So that's a typical kind of run time in terms of, yeah, but that's also happening every day, every weekend, every holiday, et cetera, et cetera. So that's how it normally works.
Laura said, can we have more than one bot? As in, you may have more than one team member filing documents. So there, I think you would, for each practice, you get your own copy, but you would get 2 super users, so 2 applications installed. So you can have 2 people configuring it after the initial setup. Not sure if that answers your question, Laura. If not, just pop another one in.
I think, yeah, exactly, John. And just on that one bot, so what the costing allows is per bot. That makes sense. So that typical costing provides you with 1 bot in the virtual machine, and that would effectively run multiple times a day, filing all of the letters in your not in folder. If you wanted to buy another one, then what that would mean is it would just, again, it wouldn't be very cost effective, because I think the 1 bot would more than amply file all of your letters on a day-to-day basis, because there's never going to be a backlog. It's not like again, I know everyone's very busy, but it's not like Teams where you're dealing with hundreds and hundreds of letters in backlog. There is no backlog, so it's just literally processing its day's filings, as opposed to yesterday's filings or 2 days of filings. It's always doing current day, because it's cleared everything out.
Super. Leah has asked, will it send 2 reviews if a letter has 2 actions needed, such as a med change and a referral request?
No. No,
Unfortunately,
you've only got the ability. No, it just can send to one review, create 1 task against that letter.
Super. Thank you. Appreciate we've gone over a little bit of time. And then Nisha, cost if part of a PCN, we will have somebody reach out to you, gather the information, and then provide you a formal costing. Perfect. I think we've now covered all of the questions. Let's just minimize that. Ladies and gentlemen, thank you very much for your time. I know it's in short supply, so we hope it was a meaningful discussion. And if you require any clarity, please do reach out, and one of the team members will certainly reply and solve for you any of your clarity that you may need.
Thank you.
Perfect.
Thanks, John.
Thank you all. Have a good day.